Hi, I'm Dr. Richard L. Robles. I'm the author of the book, The Path to Health, a manual for proper care of the human body. Today I'd like to talk to you about traumatic brain injury, also known as TBI. Right now there's an epidemic of mild TBI cases that occurs every day in athletes of all ages. If you or a loved one participate in any contact sport, you need to pay close attention to the information I'm about to give to you. Your brain's health could depend on it. Awareness of the damage caused by TBIs has been increasing over the years. There's even been an increase in the awareness of the long-term impact that it has on your future brain health. I'd like to talk to you about what you can do to decrease those effects, as well as improve the health of your brain. The major causes of TBI are falls, motor vehicle accidents, and injuries during recreational activities and while playing sports. The two most common documented causes are falls and motor vehicle accidents. This is primarily because most people do not seek care from their doctor with concussions and other mild TBIs, so therefore they go unreported. They're oftentimes deemed inconsequential as well. However, even mild TBIs are a problem that should not be ignored. If you or a loved one suffers a TBI, this is what you need to know and do. The first thing you should do is get examined by a healthcare professional to rule out more severe problems. But the advice that they give you about watching or waiting for other signs or symptoms is not enough. You need to take your brain health into your own hands, and you need to do it now. With all due respect, most doctors don't have a clue how to build better brain health. This is because they're primarily trained to spot disease. And a lot of doctors will tell you that if you don't have a disease, you're healthy. This couldn't be farther from the truth. You see, not having a disease is only one component of being healthy. And this is a really important point when it comes to TBI. Just because your symptoms go away, it doesn't mean your recovery is over. And taking a passive role by watching or waiting for worsening symptoms is not great advice, especially when you can and should do something about it. You see, most people are aware that there's some type of damage that occurs with TBI, and they assume that once the symptoms go away, their brain is healed. Although this is partly true, you need to know more about it. With traumatic brain injury, there are two levels to the injury. You have the damage from the head injury, and you have damage from the inflammation caused by the head injury. Of all the damage that occurs with TBI, about half can be attributed to the actual impact of the head. The other half is attributed to the inflammation resulting from that impact. Obviously, the best scenario would be to avoid a head injury altogether, although that's not always possible, so you need to know how to combat the inflammation from a head injury. This can decrease the effects of a traumatic brain injury by as much as 67%. This is the reason why you need to do more than wait for the symptoms to go away. The amount of damage caused by a traumatic brain injury is directly related to the health of your brain prior to the injury. Here's what you need to know. Your brain is composed of different types of cells. One of those cells, a neuron, is very important to brain health. Neurons are one of the primary signal carriers of information to and from your brain. They carry information like memory storage and maintaining balance, coordination, and accuracy of movement. At birth, you'll have the greatest number of neurons that you'll have during your entire life. As we age and develop, our body selectively destroys these neurons to optimize the function of our nervous system. In addition to this normal destruction of neurons, they can also die faster if you don't have three essential things. Number one, optimal glucose levels or blood sugar levels. Number two, oxygen and the ability to carry oxygen appropriately. Oxygen and glucose are the two fuels that your brain needs to function normally. The third component is stimulation. This comes from performing activities as well as production of something called neurotransmitters. We have a few major health problems in our country. One of those major problems is the high rates of adult and childhood obesity. This is very problematic for brain health because abnormal blood glucose levels will injure your brain. And when you throw a traumatic brain injury into the mix, it's like throwing gasoline on a fire. Not only do you have the damage from the TBI, but you're damaging an already injured and stressed brain. If you want to better understand the impact that abnormal blood sugar has on your brain, simply Google type 3 diabetes. In health, we lose about 1% of our neurons every year after the age of 20. If you don't know how to take care of your brain's health, this number will inevitably increase, and you will eventually suffer from brain problems as you age. Not because you're getting older, but because you've been damaging your brain for a longer period of time. Too many doctors are not educating their patients about the devastating effects on the nervous system of abnormal blood glucose levels. This is made worse by a healthcare system that is designed to primarily treat disease and not to build health. Frankly, This system allows people to mistreat their body while masking the abuse with medication. You need to take your health into your own hands. And you have to understand that you're the only one that can make your body healthy. There's no drug or supplement that can do it for you. It's your responsibility. That's where a doctor like me comes in. My job is to help you understand where you're at with respect to your brain health. Assessment of your health is vital to understanding what you need to do to maintain or rebuild the health of your brain. Unfortunately, it's not enough to get an all-clear declaration from your doctor or even your neurologist. Remember, they specialize in spotting disease, not in assessing the health of your brain. This is the reason why you haven't heard this information from them, because they're trained to spot disease and pathology once it presents itself in a recognizable pattern. My job is to help you understand how to care for your brain and decrease the impact of head injuries. 95% of my patients improve faster than patients who follow the advice of their other doctors after initial care for TBI. The information that I'll give you is that important. There are two ways you can get this information. Both involve consultation in my office. Option 1 is my best recommendation, and that's to call my office at 909-949-0155 to schedule your traumatic brain injury consultation with me. The fee for consultation in my office is $195, but because you've watched this presentation, the fee is just $79 for children under the age of 18, and for adults age 18 and over, it's only $99. At this consultation, I'll perform a neurologic screening to assess your brain health and evaluate any pre-existing damage. I'll also go over with you how you can decrease the impact of traumatic brain injury by as much as 67%. The second option is my next best recommendation, and that's to call my office to reserve a seat for my upcoming brain health seminar, or to get on the waiting list for my next seminar. At this presentation, I'll go over the information that I just gave you in greater detail. You'll also have the opportunity to ask any general questions about how TBIs affect the health of your brain and your future health. There's also one more option, and unfortunately many of you watching this video are going to take that option, and that's to do nothing. You see, information without action is useless. You need to take your brain health back. You need to find out how to do it, and if you haven't found out how to do it from your doctors, you need to look somewhere else. So please call my office at 909-949-0155 and let us know which option you'd like to choose. I'm Dr. Richard L. Robles, and I look forward to helping you get on your path to better brain health.